Hello everyone. Today I want to give you some updates on nursing application, that is application into colleges of health as well as nurses training colleges. Um, as you might have been aware, the application has been open about close to a month ago, and then people who have been interested have been going through the application process. The updates currently is that you have about some few days to the closure of the application. So if you are somebody who is actually interested in institutions that fall within this category, then you have these few days to be able to make the application which involves purchasing of the e-voucher, doing the application on a portal, printing out the preview application form and keeping, and then hopefully waiting for the second phase, of course, of the application, which will be invitation to interview. So try as much as possible to do your application if you have interest in nurses training colleges and colleges of health. I want to give you some key insights as well to the application. Few of you who are currently yet to do the application, you can only use one e-voucher for one application. One e-voucher, one application. You cannot use one e-voucher for multiple applications. So if you are interested in purchasing or applying to more than one school, it means that you have to buy multiple e-vouchers. Okay, so when you buy it, you do the respective application, and then if you need an extra institution application, you need to buy another form, which is one very important thing. So you have to take note of that. Then another thing also is that when the applications are closed, there will be a time frame for invitation to be extended to people who have successfully done the application, for them to come for an interview, which is one of the phases of the application. So if you are sure that you have submitted your application, you have done all the necessary fillings, especially contact details, which are email addresses, and then your telephone number actively, then you should actually be waiting for invitation to interview, which is part of the admission process, which is actually going to be coming very, very soon. Now, there are people who are raising some concerns about cutoff for nursing application. I've actually spoken about it in the past, but I want to re-echo. If you are applying for especially certificate in nursing, which is nursing assistant clinical and nursing assistant preventive, you have the luxury of using an E8 in any of your core subjects or electives to apply. If you want to apply for diploma, you will not be able to do application using E8s and D7s. You cannot. Even if you have done that, you will not be admitted under any situation. So that's one of the key insights. Now, what does that mean? Even if you are going to be applying with E8 and D7s, I strongly advise you not to use multiple D7s and E8s to do the application, because the application, even into certificate nursing, is now very competitive. So somebody will be coming through with D7 in only core mathematics. The rest of the subject, the person has passed very well. Even if it is you that is on the admission committee, you may not want to admit somebody who has multiple E8s over somebody who has only single E8 with better passes in other subjects. I hope you are getting the point. So even if we extend or explain that you can use E8 to do application, it doesn't really mean that you should pack E8 in a basket and use it to apply. You may not be shortlisted or admitted for the program. If it is a diploma, you are strictly adhering to A1 to C6 for the application. Nothing lesser than that. A1 to C6 better. You are doing C5, C4, B3, B2, A1 better. That is just the point. So make sure you follow these tips. If you are yet to purchase the form, it's still open. You have a few days to go. Try and do your application now before the deadline elapses. Thank you very much for watching this video. A lot of videos are already on the platform. I encourage you to watch them, like them, share with friends as well who may be interested in information of this kind. Thank you very much for watching.